Today, I'll be conducting an interview with a mental health occupational therapist to hear her views about autism and how it's treated, along with other surrounding issues. So, would you like to introduce yourself?
Hi, yes. So I'm an occupational therapist working in mental health services. Have been for gosh, 12 or 13 years now. Makes me feel really old when I say that. And yeah, so it's just, I also have a diagnosis of autism and dyslexia myself as well, as being a professional. Just sort of as we go through the talk, I just wanted to let people know as well that some of it might sound quite critical, and I will have to use some of the language around sort of deficit and things like that, just when I'm talking about it in terms of medical descriptions. But obviously, that comes with caveats. So please don't take anything the wrong way, and please don't feel that because perhaps I'm being critical of certain constructs that it's a criticism of people's difficulties or problems, or saying that difficulties aren't real or anything like that. It's nothing like that at all.
Okay, thanks for making that clear. Okay, so what's motivated your journey into becoming a mental health occupational therapist, and why did you choose to specialize in autism?
So I kind of fell into being an OT. My initial interest was to do psychology and sociology at uni, and I was a bit discouraged from that by people in my life at the time. So I ended up doing history, and I couldn't find work after that. So I ended up just by chance joining an OT conversion masters. And it really grew on me. There was just so much about occupational therapy as a profession, the way that it's person centered, the way that it
Mm-hmm.
looks specifically at quality of life, and just the flexibility of it, the adaptability. We're quite maverick. In our approaches, in our therapies, we tend to borrow from everywhere. We're just sort of looking at what suits the person and meets their needs. Autism came about for me when I was working on one of the mental health awards for adolescents and young people, and I was seeing quite a lot of young autistic females on the ward, and many of them were sort of exhibiting behaviours that I had around sort of the same age. And I hadn't really realised or thought about it as being autism up until that point. So that was about 5 or 6 years ago, and it really sort of broke down my assumptions and stereotypes around autism during that time. And then obviously sort of having my own ND or neurodivergent label of autism, although I have had dyslexia or been recognised as being dyslexic since I was about 11 years old. So that's a roundabout way of sort of the story of how I got into OT and autism.
Okay, so was you surprised at all by the diagnosis?
No, I wasn't. I think, I for a long time I'd kind of felt that there wasn't something quite right, and I had looked at the personality sort of framework,
Mm-hmm.
and I'd looked at what was borderline. I think it still is borderline, but some people maybe know it as EUPD, and that didn't really fit or make sense. I'd looked at schizoid, which sort of fit, but I wasn't really sure. So it was
Mm-hmm.
really only when I was working with one of the psychiatrists on the unit, um, and developing my understanding of autism from then, that I started to think that that might be the case. And then I spoke to colleagues, I spoke to a private psychologist as well around that, and they said, well, actually, you need to think about this. And then I sat on it for a couple of years and debated it. And then I went on the NHS waiting list for 3 years. And then at
Mm-hmm.
the end of them 3 years, I gave up, and just went for a private referral in the end to get that diagnosis. So no, I wasn't surprised. Really, they just kind of confirmed what I knew, which was that I could meet the criteria.
Yeah, and because I've heard that it's rarer for females, so yeah, I've heard that as well. So, in your experience, what are some common misconceptions about autism, and how can these misconceptions be addressed to like sort of help people to get a greater understanding of what autism actually is?
So this is a question that actually was hard. It's a hard one to answer.
Mm-hmm.
I think we have to acknowledge that at the moment there is the concept of autism is in massive flux. So we have that traditional historical version, the medical side of it, which is what you'll see in the DSM, in the ICD-11. It's very about deficit based and neurological differences and things, and it's but we haven't got a proper framework really to be able to evidence quite a lot of what we're saying there. There's no universal theory there. And then on the other hand, you've got more of this sort of social movement perspective on autism, around it sort of being something that where the difficulties are more caused by social situations, and the way that people are treated for being different in society, that is then causing that sort of mental distress presentation, that can come alongside it. So really it is this question of disorder versus, accepting it as a neurocognitive difference that's inherent within populations, which is a bit difficult if you are sort of looking at individuals perhaps that have significant learning differences or difficulties or intellectual impairment or other syndromic conditions that can also produce sort of autism, or that person would also meet the autism criteria in addition. Sometimes we find that we get quite mixed up with that, and people can feel quite threatened by the more sociological view of autism as a natural difference, and feel like it's sort of threatening their rights in a way, and as well as sort of their experiences of how difficult it is to live with the diagnosis. So the medical side of it really is kind of that idea about support needs, and the levels of support that a person would need. But it does get read quite a lot as being mild, moderate, severe, which is a little bit unhelpful. And also when we're thinking about support needs for people, everybody has support needs across the lifespan. Even the healthiest person at some point is probably going to need support from others for things. And so there is this issue where we kind of sometimes feel like we should go and get a diagnosis, or we should be giving a diagnosis just because certain traits or behaviors are present. But actually, there's lots and lots of individuals that would be high in the traits that are not, I'm not saying that anybody has a perfect life. Of course nobody has a perfect life, but it's more like the normal everyday kind of stress, and they're doing quite well. And now there's that debate whether should they be able to self-identify, rather than having to go through that lengthy formal diagnostic process, which is exceptionally stressful. So so there's
Right.
been a big shift in what we would consider, historically it was this condition where it was very profound learning needs, unable to socialize at all, and now we're seeing sort of people holding professional careers and things like that also receiving the sort of same diagnosis. So I think we have to be aware that it is one of those diagnoses which is an amalgamation of factors and different things going on. We probably actually have lots of different syndromes that have been given this sort of name of autism because of the way they represent, as well as lots of other life experiences. When you think about the basics of the criteria about it being about social communication and interaction, and then the rigid repetitive behavior element, if you have high anxiety levels, the likelihood is that you're going to have more difficulty with change. You're potentially going to be more in those sort of behavior patterns for comfort. You see a lot of OCD co-occurrence within individuals who have autism, as well as other anxiety sort of disorders come up quite a lot within the population as well. So there's that. I think sometimes the community kind of assumes that autism can't be misdiagnosed, and that other diagnoses, if you've been through the system and you've got anxiety and depression as being the leading diagnosis, and then you get an autism diagnosis, sometimes people can think that the professionals didn't know what they're doing, and that autism is my proper diagnosis, and depression and anxiety aren't. And that's really not the case, because there is no reason for an autistic person to be anxious and depressed all the time. That's something that on top of that, of sort of that feeling of not being considered a valuable part of society, of not having your needs met, of people constantly crossing your boundaries, which generates that kind of interpersonal trauma, that experience of people just not being able to accept you for who you are, which then can lead on to more difficulties. So and again, it's one of those things that isn't very descriptive. As I've said, you can meet that criteria for in a lot of different ways, for a lot of different reasons, and you can have very, very different needs under in that space. So there's a lot going on, and I think
Mm-hmm.
people should be aware that it's not necessarily that straightforward. Somebody's told me, I've got autism, that's the be all and end all of it. I don't need to think about anything else. I don't need to consider situational factors or personal challenges or anything like that. That this diagnosis covers everything, and it doesn't. And sometimes we get into a habit of overshadowing, diagnostic overshadowing. And I'm sure people will have had this where they've gone in to say a mental health service because they've got OCD, and the clinicians turned around and said, oh no, it's your autism, see you later. That does
Mm-hmm.
happen as well. So I think we just need to be mindful of those assumptions around autism, and whether we want to keep it as a medical term or in the medical sphere, if we're just not getting the consistency of data to say that it's a genuine pathology or a genuine thing that requires some kind of specific treatment or intervention. It's very mixed. So we some circles, for example, Luke Bearden is well known for talking about this. It's like, in a way, is it like introversion or being left-handed or homosexuality? Does it occupy more of that space than
Mm-hmm.
it does sort of concepts like being a true disorder, if that makes sense?
Mm-hmm. So there's a possibility of like making it not pathological anymore, making it just, as you said, a neurodifferent rather than a neurological disorder. And would you say that it was helpful or not helpful when they took away the categorization of Asperger's? Because that sort of differentiated between the people that had like high difficulties in functioning and other people that were more highly functional. Did you think that was useful or not particularly useful?
I mean, it's a difficult one. I don't want to like sort
Mm.
of talk
Because
you off
right,
on it.
depends. Okay, that's we can
Yeah,
move on
yeah.
to another aspect of that then. But what you said was it was interesting. I heard what you said. You're talking about comorbidities with autism and also like life situations that someone could be going through, situations in their life that's causing them to manifest autistic like symptoms. And also some of the factors, like for example, if they are being overly rigid, it could be because they have obsessive compulsive high in those traits, and it might not necessarily be because they have autism per se. So it sounds that there's a difficulty in where to draw the lines, like actually where exactly what exactly is autism versus what are other factors sort of combining to give an autistic like impression.
Yeah, absolutely. And I
Mm,
think we can only be more honest with people about, the fact that it is a real mixed bag. Even if we're sort of trying to look at theory, if we're trying to look at neurobiological data, it is a real mixed bag. Behavioral presentations, all very different, and I
mm,
think, that point between sort of, I suppose, Asperger's and, what I would probably call classic autism or Canner's autism.
mm,
Um, it's difficult because I think, with Canner's autism, there was this perception of sort of intellectual impairment a little bit as well.
mm-hmm,
And whereas Asperger's was deemed to not have the intellectual impairment side of things,
mm-hmm,
but to still have the difficulties. And again, it's that sort of that idea of high and low functioning. I
mm,
feel like, because I would have been Asperger's, no doubt about it.
mm-hmm,
It makes it hard then to sort of say, well, actually, no, I'm not a watered down version of something else.
mm,
I have specific sort of difficulties or specific experiences that are specific to my sort of cluster, not that I'm a watered down version of those guys over there. So I
mm-hmm.
think that putting them together and having this concept of a spectrum, I know it was intended possibly to help with that, but I'm not sure that it really has, if that makes
Right,
sense.
yeah, yeah, it does make sense. It sounds to me that maybe a more sort of tailored approach is necessary rather than sort of trying to put someone into a category and just saying that's that. That maybe like sort of more tailoring to the individual needs of people and taking into account sort of specifics more than generalities, maybe.
Yeah, absolutely, absolutely.
Mm,
I think we need to go back and have a bit of a rethink on that. And but it is happening slowly. I've seen sort
mhm,
of other trusts, my own trust, um, working hard to try and look at sort of creating something that is meaningful to a person and not just handing them a piece of paper that says, "Oh, well, yeah, I can tell you what you already know," which is that
mm,
you meet this criteria for whatever reason, and getting back to saying, "Well, actually, here are your strengths. Here's the areas that might be difficult. These are the needs that you've said. This is what we can do
mhm,
to meet them. There's some stuff that we can't meet for whatever practical reasons, but maybe you could go over there and these guys could do that for you." That's much
mhm.
more meaningful than just giving a person a label, I think.
Okay, and have you encountered any particular challenges or successes in promoting understanding and support for people with autism?
Um, I think there's been a real change in attitude generally.
Mm,
And I think clinicians would like to do a lot more than they're able. I think the difficulty is that there's so much demand in all different directions. So, it's not just, the autism category that's sort of been re-examined and thought about differently. There's lots of other spaces, how we treat psychosis, for example, how we manage depression. So, there's a lot of change and to take on board there, and a lot of new information for clinicians to sort of chew over and mull over, and many of them have had years and years of this cycle of sort of change, and a lot of the stuff that they did historically probably was what we kind of need now, but then they were told not to do that, and then they were told to
mm,
go into this very sort of model where you very much categorize people and chop people off, and all your services are sort of
mm,
boxed and limited to certain diagnoses. Now we've been told that we don't do that anymore, and we're going back to what we had before. So, I think the biggest factor isn't sort of the willingness, it's the fact that most services and staff are just so overwhelmed and distressed um,
mm,
with everything that's going on that they're just struggling to get it on board. And the other
mm,
part of it is the resources coming through in a smooth and sort of easy way. Everything's very sort of bitty. It takes a lot of sort of waiting around. The commissioning groups are all kind of weirdly divided. You've got GPs that are in charge of commissioning that have sort of different groups. You have commissioning to diagnostic teams that are out of area. So you can't have that sort of shared space between the service that the person's already in when they're sort of looking at these diagnoses. We've got public expectations as well around sort of, if I get a diagnosis, it means that I'm going to have all of this support and help. And then they get to the end of that process and they find that it's not really there for lots of different
mm,
reasons. This idea that people can't help each other. Like it always has to come to a professional, always has to be an expert. That people on the ground, your neighbour and stuff aren't allowed to interfere because, oh, mental health, oh, that needs an expert, that needs a GP,
mm,
and actually you can just
yeah,
sit down and have a cup of coffee with somebody and do a lot. Um,
yeah,
so there is that fear to overcome, and I think because the labels have filtered down to the public but perhaps not in the most sensible fashion. We do a lot about raising awareness and perhaps not very much about talking over the realities and what people can do
mhm,
around support. We tend to just say, oh, look at this condition, if you think you have it, go and see your GP. um, which isn't ideal, and especially if we're giving information that's very generic,
mhm,
that can be very easily look like general life experiences and difficulties. There's going
mhm,
to be a lot of the population then that's going to feel quite uncertain and quite anxious and think, oh my God, maybe I have this because, I don't sleep very much, and I sometimes do this thing. And so, we do see that anxiety sometimes in some of the people that come to see us. Um, but yeah, and I mean, and the biggest thing actually is that we could do with the better social care system. I mean, that's
mm,
the bottom of it. There's only so much an NHS doctor can do. The
mhm,
real issues are, people not having proper housing, proper finances, jobs that are safe, jobs that are stable and not traumatizing, educational environments that are stable and not traumatizing. You know, that's where it kind of all needs to go. There's not very much that me, a little clinician in a mental health team, can do regarding those bigger issues.
Yeah, that does make a lot of sense actually. It sounds like really there is a need for quite a lot of systemic reform so that it can actually support people more fully when they are getting diagnosed, and to also like to help them understand sort of like what they can expect, like, do you know what I mean, realistically, maybe going forward. And I wondered, like, around your own personal experience, having been diagnosed with autism, like, and maybe like a little bit like in terms of knowing your own symptoms, if that has that helped you in your professional approach or in your research or in what you want to accomplish through your research, like knowing your own symptoms and how it affects you as a person.
Um, y- it's a hard one.
Mm,
I'm gonna sound really bad here, and I think this might be a little bit to do because of my professional background, but it didn't tell me anything I didn't know. Um,
right.
and I already sort of maneuvered myself into spaces that were going to suit me, just through sort of trial and error and a bit of luck really as well.
Mm-hmm.
So you know, having the additional diagnosis, I mean, the reason why I picked it up and decided to finalise it was because I was going to go back to university to do another master's, and I just wanted to make sure that I had spotted I've had, it's made no difference, to be honest. It was a waste of money,
Mm-hmm.
you know, from that perspective. So I learned that hard lesson actually, that my dyslexia diagnosis that I already had pretty much already covered me for that. And I think it's worth people knowing that under UK law, we are actually protected from that perspective, that it should be needs based, not diagnosis based. So anybody who turns around and says you can't have something because you haven't got the right diagnosis needs to be challenged on that. So for
Mm-hmm.
me, not necessarily, but I think a lot of people feel validated about their experiences, about how difficult life is. You know, when you have something, you can name it, you know, you've got a construct for
Mm-hmm.
it. It feels a lot better than sort of wandering around in that empty space.
All right. And would you be able to sort of highlight some of the most like common problems that people like report who have been diagnosed with autism, like in general, just from your experience? So,
So I suppose, do you mean from the perspective of life difficulties or challenges getting into services and stuff like that?
just life difficulties, like how their symptoms affect their day to day lives, right?
Okay. So I think the biggest one is the social communication aspect of that constant sort of misunderstanding,
Mm,
and having to work really hard. I mean, some people can do it. Some people, through a lot of cognitive effort, can do that. Some people can't. You know, for whatever reason, but it is that sort of constant fear of sort of criticism and misunderstanding that goes on, you know, and especially if you're an autistic person that has sensory needs. So we don't all have significant sensory differences, but the ones of us that do, you know, that constant overstimulation potentially, you know, that is very difficult to deal with, especially when people can't understand that, can't understand why. And I think that these
mm,
problems tend to show up the most during the times of our lives when we have the least control. So things like childhood and adolescence, you know, you're in school, you know, you've not got choices. You know, you might have parents that perhaps don't understand that you're a little bit different, that you see the world a little bit differently, and you've got all of these things imposed upon you, all of these environments imposed upon you. I think this is probably why we see, you know, as people move into adulthood, typically, if they're lucky and they've got the right resources, that they can eventually find their own space to settle into, the types of people that they want around them, and start to be a bit more selective. But, you know, that is something that's really privileged. So, you know, if you are an individual that doesn't have that luxury, and, you know, I know that, for example, a lot of us, used to sort of hide in universities and things like that. But if you don't have that luxury, if you've got to go work down Tesco's,
mm,
you know, 7 days a week, you know, that's massively challenging. If you've got sensory differences, communication differences, it's just very stressful. I think the other side of it is that people often see our stimming or are sort of have ideas about us being rigid and restrictive. And I
Mm-hmm.
think this probably extends across neurodiversity as well. But, you know, if you've got a difficulty, like some of the difficulties that we can have, that structure, those strategies, they're there for a reason. And so when people come in to interfere or they disrupt that process somehow, all of that sort of heavy planning and making sure and knowing what I'm going to do and knowing how I'm going to say that, and it goes out the window. um
Mm-hmm.
and then it's really hard in the moment to try and sort of process everything and try and
Right.
restructure something else.
Yeah.
So to other people it looks very silly, like, oh, I just moved some stuff. But for us, it's, you know, it's like, well, I can't necessarily remember where that thing is. I only know where that thing is because I always put it there. If you move it, it's blind to me. If I'm looking around the
Okay.
room and it's somewhere else I'm not expecting it to be,
Okay.
I'll pass over it. So you know, it's things like that. That's just a personal example. We'll all be quite
Yeah.
different, but it's that kind of stuff.
Mm-hmm. And that's the sort of thing I suppose you'd want people around you to be aware of so that they can like take that into account. And in some situations, it might be difficult for some people to explain to the people that are around them, like if they're in a new job or that they have these sort of specific type of difficulties.
Yeah, absolutely.
Mm-hmm.
I think the other thing as well is just, you know, in terms of the research and stuff like that, when I look through it, um, I I'm actually still shocked today about sort of the types of language that we find used towards the studied group, um, you know, versus the control group. I mean, I look at other literature as well, but autism in particular, you know, just some of the language and the assumptions around us, you know, as a person that carries that diagnosis, that label, uh, you know, it's painful. Some of it sometimes is painful to read. You know, I was reading one paper the other day that was looking at pediatric services and telling the difference between the various neurodevelopmental conditions and mental health conditions that you can find in children. And one piece of advice was basically to base your judgment a little bit on how much you like the child.
That
You
sounds
and you
wrong.
know and you're just thinking, how on earth has this got past an editor into, like, what
I
are
know
we
it sounds
doing?
unbelievable. Goodness. Yeah, it's crazy. Yeah, I think that maybe when you go back in time, like maybe to like the 1970s and those sort of eras when they were like writing reports on certain people, they were quite sort of derogatory and seeing people literally as objects and not really incorporating the human aspect into it so much because these are still human beings and people, you know.
Absolutely. And you know, it still goes on. You know, that paper is only from 3 years ago.
Okay, I see your
Um,
point. Yeah.
yeah, yeah, yeah,
No
yeah.
excuses there then.
Yeah, yeah.
Mm,
Yeah, and you know, and you still see it. You know, I'm just trying to think of sort of other examples, but you know, some of them talking, you know, again, a lot of savantism mentioned, not specifically, but this special idea that autistic people are all going to be in STEM or IT, you know, not much
oh,
space
oh,
for those
right,
of us
right,
that are
right.
like, you know, into
Yeah.
art or, you know, other aspects of life. You know, it just goes on and on. Everything that we do that is different, we do it, you know, to be a nuisance, or we do it because we've got something wrong with our empathy, or we do it because we are not interested in other people and their well. There's, you know, there's still that theme that the language changes a little bit here and there to look a bit better, but there's still that sort of core theme of, you know, the problem is you guys, and you're weird and you don't
Hmm.
like people, and your scatterings of sort of being antisocial. This is being challenged by some researchers, it's not every researcher, and especially by autistic academics are obviously putting sort of a challenge to a lot of these ideas. Um, but yeah, it's still there, even in sort of quite recent papers as well.
All right. So bearing that in mind, it sounds like the jury's still a little bit out regarding what exactly is autism and how does it manifest. Do you think it's at all useful to diagnose autism in children? Is early intervention of any use to sort of supporting people who may go on to develop further symptoms as an adult. So
Oh,
it's another difficult area. It sounds like it's all difficult. I
it
know it sounds.
It is. It is. So it depends on the family. It depends
Mhm,
on the child. It depends on the professionals around them and what's actually gonna happen as a result of that.
mhm,
So good case scenario. Parents are switched on. Parents say, I think my kid is got a neurodevelopmental condition in whichever direction. Please, can I have some help and support about finding out which one it is? They get a diagnosis. They get support. They get education. The teaching staff adjust and adapt to the kid. And that child is well supported and accepted, and people work with that child within their personal boundaries and limitations to encourage them to grow sort of on the trajectory that sort of works for them. Worst
mhm.
case scenario is you get a family that is upset because their child isn't performing or doing the things they want them to be able to do, and you get a set of
Okay.
professionals that are wanting to correct or make sure the child meets a certain standard or is doing a certain thing, and then that child spends a lot of their what should be time to sort of develop and engage and have their own curiosity, engaging in interventions, some of which might be quite sort of harmful, some of them going on for hours and hours on end,
Mm,
pulling the kid out of their favourite classes to go and do some remedial stuff, because you don't think art is important or music is particularly important, so they can come and sit and, do social skills training for that stuff is damaging.
I
Um,
wouldn't like that at all.
yeah, yeah,
Yeah, I can see what you mean because it's like for example, say you have a parent who feels that the child is underperforming. The child might be performing to their capacity for who they are, and because the parent has other expectations, it may be pushing the child in directions that's not natural for that child's development. So, as you said, I could see how that would cause like more harm than good because the child could actually be traumatized by being singled out for this so-called like special treatment that maybe the child doesn't have any real consent in, so maybe their views might not be considered during this process.
yeah, absolutely, absolutely. And today I think we're trying to move
Mhm.
away, from that kind of sort of intervention. I know lots of education professionals are trying to look at ways to be more inclusive. So rather than, obviously, we need to be identified isn't the issue here, it's the response
Mhm.
to that identification.
Mhm.
But looking at ways to improve sort of education structures and systems so that neurodivergent people are benefited, that they're not harmed, they're not damaged by that process, but
Mhm.
everybody else is sort of benefiting and doing well as well. So that
Mhm.
in terms of what we're looking at, in terms of most services and things, it's just, if you can make your environment, if you can make your situation, if you can make the way that teaching happens sort
Mhm.
of suitable for everybody, or at least it's flexible enough to enable people with differences to also thrive within the sort of same context and same space. That's much better than taking those people out potentially and
Mhm.
doing a load of stuff to them and making it very obvious to them that they are othered, they are different, they are
Mhm.
lesser than. I'm not saying that certain schools, because there are some schools that do specialise in autism. I think there's an autistic girls' school somewhere in the UK, and they do a fantastic job, because once the girls are there, their strategy is that strategy of actually, let's go with what's good for you, what's your trajectory, what are your strengths, what are your skills, where do you want to go, what's your curiosity, how can we build your confidence in doing some of those scary things or some of those difficult things, how can we build up your strategies so that
Mhm.
later on in life, that's where we need to be. But there is still this attitude in some spaces of, like ABA style therapy, where I'm just going to plonk this kid down and hammer them
Mhm.
with stuff. It's just, yeah.
Right. Okay. So, do you think that like society needs to be more empathetic in general in supporting people who have mental health differences? Like,
Yes. Yeah, absolutely. Absolutely. Yeah, I mean, I think we all have differences and challenges. So I don't see why it's so difficult for us to extend that to people who are less like us. I mean, that's really what we're talking about is sort of two
mm-hmm,
well, more than two, multiple ways really of sort of
mm-hmm,
seeing and experiencing and being in the world. Um, and if we can make space for people like us that are having difficulties, I don't see why we
mm-hmm,
couldn't make space for people who think more differently than we do. To be supported as well, and just as well, actually, not shoved off to the
mm-hmm.
side, not shoved into a
Right.
special service.
Yeah, because you did mention in the past something about looking into adjacent disorders. Because do you think really that all the disorders they overlap and they're on the spectrum? So like comparing and contrasting these things could lead to like greater understanding.
Yeah, so I'm sort of very interested in sort of transdiagnostic research and how that might be useful and might be helpful.
Mm-hmm,
We know that sort of some of the earlier forays into that have happened in the last couple of years are kind of showing this really big sort of overlap, and that actually the diagnosis that we give aren't necessarily reflected in neurobiological clustering when you're looking at neuroimaging or something like that. That
mm-hmm,
like your ADHDs are scattered around in with your autistic, in with your and they're all kind of
mm-hmm,
mixed up. Um, so, I think it's really important to consider that. I think in terms of if we're having discussions around people's identities and things like that, that people with other neurodevelopmental conditions have identities. The dyspraxic people have an aspect of identity about being dyspraxic, and that very specific experiences of having
mm-hmm,
difficulties with movement and difficulties with praxis and things like that. Your dyslexics have a very sort of niche experience of life. So I think we need to be careful that we don't eclipse these guys and say, oh, well, you're all just autism. I think autism is already vague enough without sort of adding more
mm-hmm,
vagaries in. But I do feel like there needs to be a coming together. And I suppose the neurodivergent label or neurodiversity, however you want to say it, might be sort of the better umbrella under which we can have these different profiles. But we need to start thinking about them as being profiles rather than these structured boxes, which neither the two shall cross over. And that if you've got ADHD, you're only allowed this kind of treatment, but if you've got autism, you have this kind of treatment. Actually, we need to look at the needs and then mix and allow them equal access as they need it to whatever it is that they need, regardless of the extra bits and bobs on the side. So I mean that's the model I would like us to see, is to be doing much
mm-hmm,
more of a profile that we can incorporate all of these co-occurring needs, even a little bit of mental health as well in that formulation process. Give a person a sense of being a complete person, not little bits and labels here and over there. And is this my autism, or is this my ADHD? Or, to be able to have a
mm-hmm.
sense of being some unity within themselves with these different profiles that they can match.
Well, this has been like really interesting because you given me a lot of insight into the difficulties and challenges that the health profession has in moving mental health care forward. And even though you mainly focusing on autism, I can see that really this has a repercussions for like the whole of the mental health field and the way that mental differences are viewed, and maybe moving away from pathologizing people, putting people in boxes and making people feel marginalized, and more giving people just like a full sort of understanding of the different aspects of their condition and how that can be managed. And I like the idea of profiling because it's something that can be updated. Like for example, like when you're talking about profiling, I was thinking of like when you have a blood test, you're like, oh, you're high in iron, or you're low in magnesium, or you need a bit more of this or a bit more of that. So like as someone goes through their mental health journey, there may be some aspects of their condition that get better and some aspects that might get worse. And so by creating a profile, you can sort of keep a check on all the different aspects of what are going on, and then you can adapt therapies according to any sort of significant changes in the person.
Yeah, absolutely. That's the dream.
Mm. It sounds really good. I think that what you said is constructive. In the beginning, you would made it clear that you didn't want to be critical, and you understand that there are still ongoing challenges in the field. But I think that with people like you who are like bringing forth like the issues of like what areas do we need to look at, what areas do we need to change, and like how can these changes help people going forward is what the mental health field does need. So I thank you a lot for this discussion. And before we end, is there anything you'd like to add?
Um, You know, I don't think so, actually. I think we've about covered it. Thank you for having
Mm,
me and giving me the opportunity to natter and waffle on. I've really enjoyed it. This is my first time being interviewed on YouTube and stuff, so I was quite excited this afternoon, and
mm,
it's been fun. So thank you.
and thank you as well.